Hello, hello. Welcome back to the season 5 of Proudly Asian. As some of you might know, we took an extended break over the holidays and New Year, but now we are back in full force after celebrating the second anniversary of Proudly Asian a couple weeks ago. Now, for this season, we'll be following a new release schedule. And for those who have been around since the beginning of Proudly Asian, you'll know that we've been releasing new episodes on a weekly basis. And in this coming season, we want to try something new. We'll be releasing new episodes bi-weekly, which means you will be getting a new episode every other week. But not because we're getting lazy, but actually quite the opposite. Because in 2024, the theme for Proudly Asian is to be conscious. That means being conscious about all the content that we put out, and we want to spend more time making the conscious effort to experiment with new content formats that you might find interesting and learn more about different topics that we'll be approaching on the show. So we want to spend more time getting to know more about the guests we have on Proudly Asian before a recording. We also want to have more time to do the research for each episode. So while we will be putting out a new episode every other week in the coming season, it doesn't mean that you will also be hearing less from us. You might actually be seeing more of us on social media and in different mediums. So make sure that you follow us on Instagram at proudly.asian and also our YouTube channel. Just search Proudly Asian Podcast for all the exclusive content that we have going on there. And now with that, I'm so glad to be kicking off the season with a topic that we are very passionate about on Proudly Asian, which is mental health. And we get to hear from a trainee clinical psychologist who brilliantly dissects the different aspects to mental health and misconceptions about what psychologists really do on a day-to-day basis. So it's a fun and insightful conversation that I hope you enjoy. And for those who will be celebrating the upcoming Lunar New Year, I hope you have a wonderful time with your friends and family and a great year of the dragon, full of happiness, luck, and laughter. Now, enjoy the episode. Welcome to Proudly Asian, a podcast series that tells bold and proud stories of Asians by Asians. My name is Isabel, your podcast host, and I'm here to find stories that challenge biases we face every day. There's never just one way to look at Asians. This podcast will take you through a deep dive into the life stories, struggles, and triumphs of young Asians around the world. On today's episode, we have Florence Young, a trainee clinical psychologist based in London. Born and raised in Hong Kong, Florence joins us to talk about her career path as a clinical psychologist, Asian mental health issues, and how you can stay sane during Lunar New Year. Welcome back to Proudly Asian. It's good to talk to all of you again. Now, just like the intro mentioned, sitting right next to me is Florence, who is a trainee psychologist who is currently pursuing her studies and placement in London. And we are so lucky to be able to have her when she is visiting home in Hong Kong. So welcome to Proudly Asian, Florence. Thank you so much for dropping by.
No, thanks for having me.
Now, I'm pretty sure a lot of, including myself, a lot of our listeners, when they see, you are a trainee clinical psychologist, there will be like a ton of questions, which I'm sure you get a lot, like from your friends and like anyone that you meet whenever you tell them what you do. But before we get started with all things clinical psychology, why don't we start with a question that we always ask every single guest of ours on Proudly Asian, which is tell us a little bit about your background. Who are you? What are you? And where did you grow up, Florence?
As you mentioned, I'm a trainee clinical psychologist currently on my second year. So I've got a year-ish left. So I've been in the UK for 11 years. So I moved there when I was 16 to do my GCSE. So before that, I was born and raised in Hong Kong. So that means my mother tongue is still Cantonese. Um, I think I speak fluent Mandarin as well. So when I do therapy, I think I basically do these three languages. Yeah, is that enough about me?
Amazing. So I'm just wondering, I mean, of course, for psychologists who practice in Hong Kong or like in China, it might be kind of a little bit easier to spot those who actually are Cantonese or Mandarin speaking, right? But in the international psychology community,
Mm.
like are Cantonese speaking psychologists kind of a rarity in your opinion?
You mean like in the UK or?
Yeah, I think maybe in the UK, or I'm not sure about like the landscape in the States as well, because
Mm.
I think maybe last year when we were having some guests talking about mental health, right? Some of them would point out the challenge of even finding maybe like Cantonese speaking mental health practitioners, not just clinical psychologists, but even like psychiatrists or like counselors. But I'm wondering if this is a known issue in the field.
Yeah, actually, not until you mentioned I realized that's really true because I'm not sure about the States because I've like always been in the UK, but even in the UK in my field, for people who actually pursue like clinical psychology or therapists, yeah, I don't think there are a lot of Chinese speaking people
Mm.
there. And also in the doctorate course in the UK, they have two routes. So majority of the places are safe for people who are British or people who hold a British citizenship. And for international trainees, they have very limited space. So for most unis, it's like two spaces. So my course as well, they only accept two international trainees. Some uni have a bit more, maybe up to six. So yeah, that explains actually not only like Chinese speaking, but international trainee that like naturally will be a lot less. Um, so yeah, I think that that's really true.
I'm curious if that will change eventually because we know that there's a growing community of like even Hong Kongers in the UK. And of course, there will be needs when it comes to like adjusting to new life and,
Yeah,
mental health support. So I'm very curious about that part. Maybe we can talk a little bit more about that if you have any examples to
yeah,
share.
definitely.
But I mean, going back to you being a clinical psychologist, I'm just so curious, like, what does it even mean?
Yeah, that's a really good question. And also a big question, I would say. So maybe let's talk about the difference between that and other terms. For example, therapist. Let's say, therapist is a generic term basically to talk about anyone who does therapy with people. So anyone can call yourself a therapist if you want to. You don't have to be qualified. But so clinical psychologist is just one of the specific qualification you get to do therapy with other people. But not only that, clinical psychologists also do other things like clinical assessments, or we do some what we call indirect work. So like consultation, supervision, or we do research as well. And also for clinical psychologists, there's quite a big emphasis on the role of leadership in a team. So I would say that marks the difference between clinical psychologists or other generic therapists. And then you might hear other type of therapists depending on maybe where that person's from, because there's just like lots of different words kind of floating around, and it's just really confusing. So for example, you might hear, I think in the States they have like marriage therapists or counselors, or all sorts of different types of therapists. So that means they just come from different backgrounds. They have a different qualification. But specifically for clinical psychology, if you're talking about in the UK or in the States, then you have to have a doctorate degree. But then in Hong Kong, you would need to do this specific master degree from two universities here. Yeah.
Mhm. So, wow. So, the time horizon of becoming a clinical psychologist would be averaging around like what, like 7 to 10 years?
Yeah, I say commonly maybe 10 years because let's say for me personally, I did 3 years of bachelor in the UK, and then 1 year of master, and then I did 1 year of what they call postgraduate certificate training to be, again, another type of therapist to work in primary care in the UK. So, and then after I was qualified, after 10 months, I worked for about a year, and then I started this doctorate. So there are people who might even work a lot longer. Some people have 2 masters. You might also hear people already have 1 PhD before they start this doctorate. So everyone's path is very, very different. You might hear people who is even a lot quicker. They maybe only did a master with not much work experience. They get straight to it, but that's actually quite rare. So, but yeah, in short, it's quite a long path. So I think that also marks the difference between the qualification of clinical psychology and maybe counselors, where you can just do like a type of diploma somewhere that maybe is a year or 2 without needing a psychology bachelor degree. So yeah, I think to summarize is the difference of our qualification, but the common factor between us would be we do therapy with people.
Right.
Yeah.
And checking the prospects for our Asian parents listeners here. So you mentioned the time horizon of becoming a clinical psychologist takes about 10 years. So does that mean like the first 10 years you wouldn't be making much money, but after you get through that whole initial period of training and everything that's necessary to become one, like is the pay drastically higher than like the other types of mental health practitioners that you just mentioned?
I would I think it's a hard question, because for therapists to charge, you price yourself, don't you? So yeah, even like counselors, different type of therapists, because you work. Let's say you're not working for hospitals where you get like a set salary. If you work private, you price yourself. So it depends on you. Like if you think you're good, you can price yourself as expensive as you can. But if you're talking about working for hospitals, it depends which country as well. I think in Hong Kong, definitely clinical psychologists get a fixed level of pay that I think is reasonable. I'm not sure if you are like a therapist or with like less qualification can actually work with hospital authority. I'm not sure about that. But I'm not surprised that if they can't. So yeah, I think clinical psychologist basically is a profession. But then in the UK, because I guess because mental health is a lot more well established, so there are other type of therapists that is quite like they've got other qualification that's quite how do I say it, quite common, or yeah, so they'll be kind of, sometimes the work they do could be almost like same or similar to clinical psychologists, but then their pay could be maybe slightly lower, but at some point you could be even the same depending on which service you're working at. So I guess the differences in the UK is a lot less than in Hong Kong, but I would say in Hong Kong is a lot higher. Yeah.
I see. So basically, clinical psychologists in Hong Kong's context, they'll be able to work under hospital authority.
Yeah.
And in the UK, like both types of practitioners that you mentioned can also work for NHS, right?
Yeah. So for example, there's something called CBT, cognitive behavioral therapy therapists. It's you trained with like a accredited course in UK. It's quite it's quite reputable. And you can also work with the NHS as well. So CBT therapists and psychologists, sometimes their salary isn't much of a difference. Yeah.
And since we are mentioning CBT, which some people would know, it's called cognitive behavioral therapy.
Yeah.
We hear that term a lot, but
Yeah.
what does that mean?
Yeah, well, yes, when you ask me that question, I don't know where to start. Because let's explain why you hear this a lot. So basically in therapy, CBT is not the only therapeutic approach we have. There's actually loads and tons of other types of therapy. The reason why CBT is so widely used or known by many people, one of the reasons is because of how structured it is. So it's like, so it's quite a structured type of therapy where it's relatively more like prescribed. So, for example, if you have depression or if you have OCD or PTSD, I know people might not know what I'm talking about, but basically, we have different types of mental health problems. In CBT, they will like literally give you like different maybe tools or like diagrams to work with. So like you just kind of follow things, and then it's more about like teaching you techniques to learn how to manage your current problems better. So it's delivered in quite a structured way where, especially in the UK, you get like suggested guidelines where there's a set number of sessions for different type of mental health issues. So because of this nature, it makes it a lot easier to research on the effects of this type of therapy, because every is quite standardized, right? People get the same number of sessions, get kind of similar content of the therapy they get. So that makes CBT easily to be quite a strong evidence-based therapy, whereas other types of therapy that is less structured or less prescribed, um, is easily varied between different therapists, because we all have different styles. We all have different ways to deliver therapy, different therapeutic relationship with the clients. So in this sense, it makes research really hard to measure, isn't it? Because you can't really measure. You don't really know what's exactly happening in the therapy room. A lot of things might not be very tangible. So that would make maybe other type of therapy relatively less evidence-based. So I think being evidence-based is one of the big reasons why CBT is really well known. And also I think it's quite straightforward as well, because as I said, CBT focus on teaching you techniques, because cognitive behavior, right? You talk about your thoughts. So what's going on in your head, your behavior. So what do you do as a result? How do you take action? What do you not do? And how these things influence your feelings or emotions. So we look at these things and how they kind of keep going the vicious cycle here and now at this current stage. So we focus on your current problems, and then okay, we figure out this maybe thoughts or this behavior is not really helpful for you. How can we manage that better? So then the therapist will give you tools to learn how to deal with them. So yeah, in that sense, because we're talking about learning techniques, it's quite practical. Naturally, it's a lot easier to learn, isn't it? Because people could even do like self-help booklets, because it's like cooking. It's like a recipe. Okay, I teach you, oh, this dish tastes bad, and how can I fix it? Oh, because I shouldn't add the chili in this dish, or I should actually leave the dish and rest it for 10 minutes before I start eating. So it's quite easy and simple to follow. So I guess that's maybe another reason why it's quite widely applied and yeah, known by many people.
So, in that sense, is it safe to assume that actually all clinical psychologists would be able or would know how to kind of use the method of
Yeah.
CBT? I mean, CBT is not really something that, only a certain group of mental health practitioners would know how to.
Yeah.
Because I mean, I remember having, like browsed around maybe like mental health practitioner options or therapy options around, and then there would be some people who would declare their specialties as like CBT,
Yeah.
right?
Yeah, that's right. I think that's correct. So yeah, again, with maybe for the same reason, the evidence base, because it's all about psychology is actually a science, right? Because we need evidence to prove that this work. Even though it could be debatable, but that actually would make all our training very quite dominated by CBT, because it's true that it works, but then we're yet to prove that other therapeutic model is as effective. But then everything I said about CBT is just my personal opinion, just saying.
Yeah.
Yeah, because for my own course, my training, we actually have a less emphasis on CBT. So we actually, the way we're taught, while the lecturer will tell you, oh, we teach you CBT, but you can tell the lecturer themselves don't really buy into CBT. So everyone has very different opinions, but you're right about, all psychologists definitely would need to know how to do CBT, and also it's common that it's quite a main modality that people use. Yeah.
I want to go into a little bit more about the day to day of clinical psychologists because you briefly mentioned how what you do is like a little bit about assessment, research, also like leadership. But then I think these might not really answer our listeners' questions of like, what do you actually do? Like, can you walk us through, like some day to day or like give us some really tangible examples as to what those tasks would mean to a clinical psychologist?
Okay, so maybe I'll just kind of run through you like a typical day I have when I did my placement in the UK. So we usually will be assigned a caseload. So, but as a trainee, you do less, but then you have like a set number of people that you should see. So, for example, I might see 2 to 3 what we call treatment case each day. So for treatment is to see ongoing clients to do therapy. That's about 15 minutes to an hour long. And then it's quite independent and free in a way that you just schedule your slots with your client. So you can decide, what time you want to start working. So even though my working hours supposed to be 9 to 5, but I don't want to start at 9. So I always schedule I shouldn't say this, but I always schedule my clients from 10 a.m. So I'll just like casually walk into the office at 9:55.
Because you needed some time to read before you meet.
Yeah, or, just a lay in. So yeah, it's quite flexible in that way. You schedule whenever you want, as long as it works with your clients. And then sometimes I do some assessments as well. So again, you can just give the secretary what slots you have, and then they will like help you to book people in. Assessment is also an hour long, and then
So will assessment be assessing whether or not a person has, let's say, like ADHD, OCD?
yeah. So actually, again, I can't say for sure in Hong Kong, but at least in the UK, actually there is we there's an emphasis that we don't make diagnosis as a psychologist, but we can talk about it later. So the assessment basically is because I work in secondary healthcare, like a public healthcare. So with the limited resources, you can't take in everyone. Or so basically the assessment is to assess, what their main problem is, and then also to make sure, also to actually to understand what type of therapy or support would be best for them. So in our service, we don't only offer individual therapy, we also run like groups and stuff to help like, utilize the resource we have, because we have like year or 2 years waiting list. So the assessment basically is people come in, we did like an initial one, they did an initial assessment with someone else to make sure they are suitable for our service, and then psychologists would do again another assessment to get more details about what their main problem is, and then do risk assess as well. We always need to check their risks in case anything happens, and then we need to refer to other services. So in the UK, we work quite systemically, depending on what problems they have, or even like at some stage you realize this person has a problem that's not appropriate for us. For example, you mentioned ADHD. So if I did the assessment, even though it's a general clinical assessment to see what their main problem, but if I kind of pick something and realize, or even the client mentioned that I think I have ADHD, then again, I can help them to make the referral as well. So basically just kind of like an initial assessment to see what's going on with this person, how we can best support them with different resources we have.
I see. And I mean, just from what you described, your day to day is pretty much kind of like up to how you want to structure your schedule.
I haven't finished though. I haven't finished half my day. So because you might feel like I'm really free, but actually I'm really busy. So in between, so let's say I did the assessment, right? I need to write a report. So I like to write quite a detailed report. So my report might be like 3-4 pages long. So I need to write that. And then after every session, I need to write my session notes as well. Sometimes I might also share with my clients what I need to do, follow-up emails to tell them, okay, what their homework is, or like remind, I just have to do a lot of admin. And sometimes we have regular meetings as well with the team. So yeah, so in between session we need to use the time to do admin work or team meetings and stuff. But then after 5 o'clock, everyone will be gone. You can't stay for longer.
So would you say some of the days could feel very hectic, that you can barely find a moment to catch your
Yeah,
breath, or it's kind of like a rare
yeah.
occurrence?
Yeah, I would say so. It depends. Oh, I run groups as well. I forgot about that. And then like yeah, I think yeah, it depends because especially with risk, because I work in secondary healthcare, which is like a you could say like more complex kind of problems that people have. Because in the UK they have like primary and secondary level, so naturally people would be more complex. So you never know what's gonna happen. So let's say if one person under your caseload suddenly have risks, then you need to do all sorts of measures to protect the client, to make sure you've done everything you can, and then you might need to liaise with a lot of other teams and stuff. But yeah, and then sometimes you might get difficult clients, not difficult clients, but more like a quite a draining session sometimes. And then sessions, psychologists are not perfect, just so you know. So not all our sessions would run perfectly. Sometimes you
Mm.
might do less well than other times. So if that day you yourself felt overwhelmed, or the client actually come in with quite a lot of difficult problems, or energies, and you could feel really drained. So yeah, I think even though you might say the working hours is quite short, especially compared to Hong Kong, right, 9 to 5. But I would say it's quite intense.
Mm.
Sometimes my sessions overrun. I don't even have time to have lunch, maybe like 5-10 minutes lunch, and I
Wow.
need to go back. So yeah, it's quite common that you see people eat at the desk as well, because you just need to want to get the work done ASAP. But I would say I quite enjoy it because it's intense, but then it's short, rather than I have time to chill and chat with people and wasting your time, and then you like get off at 9 p.m. But yeah, that's
Wow.
how it is. But for me, yeah.
It really doesn't sound easy, because like it requires you to be very knowledgeable about any potential disciplines or like theories that exist in psychology, because like every patient that you meet is completely different, and the
Mm,
human mind is so complex.
yeah.
So there isn't really any like one size fits all. They don't
No.
all come in with the same set of problems, and their behaviors could be completely different as well. So you really have to make very quick assessments around like,
Yeah.
like to identify, or sometimes even the problems are not even that obvious for you to
Yes.
identify, right?
Yeah, I mean, also it depends on which service you work at. So if you work at like A&E, you even have to a lot quicker, because you don't have a lot of time to decide, okay, what's wrong with this person, what's the problem, where should this person go. But then when you mention about we have to be really knowledgeable, I wouldn't say we are really knowledgeable, and I also personally try to avoid feeling this way, because but it's true that we have to learn a lot of things. It's like a GP, right? It's like a gatekeeper. You need to know what a bit of different things, but it's hard to be able to know a lot, or specialize in lots of different things. So I think as a psychologist, and the way I was trained as well, I would try to remind myself that I don't know anything. I don't know everything. Not anything. I don't know everything. Maybe that's true. I don't know everything. And I always sometimes I would remind my client, if I feel like there's a bit of power imbalances there, where they put me in an expert position, I would remind them that actually I'm not the expert. I'm just here to help you figure out things together. But they are actually the expert of their own story. And I
Mm.
think that's really important. So, like, know what you don't know, because it's very easy to make assumptions if you think you're really knowledgeable, or put yourself in an expert position. And that's very dangerous, because we can't read minds, just in case people think we can. So we say that we have like a not knowing stance. So like, I actually don't know anything. I'm here to ask you questions and find out what's going on.
Wow.
So I think that's really important, but I don't think all psychologists would work this way.
Right.
So yeah.
I really love that approach about how you encourage your clients to think of themselves as the expert of their minds, their own emotions, because I think we live in a place where part of the reasons why so many people struggle mentally is because they feel a certain way, but then maybe the society or like the community that they are in, or like the people around them, or even family members around them are telling them that that's not real. Like what you're
Yeah.
feeling is not real. And people will eventually become convinced that, you know, like other people's versions of like how they are feeling
Mm.
will kind of trump what they think is going on in their
Yeah.
mind. So I really think that's a very good mindset to adopt.
Yeah, and I think what you said was a really good point as well about how our feelings should be validated. Because sometimes I get client would ask me, I have this and that. Do you think is a problem? And then I was like, well, I'm not the person to tell you if that's a problem. It's only you can say that is a problem or not. And if you have certain feelings or certain thoughts and stuff about this, then they are totally validated because that's just how you're feeling, right? There's no right or wrong. So you're the person to decide if this is causing distress for you. If you think it's actually problematic, then it's a problem. But I guess I would try to avoid to again be the expert and tell people, oh, I think you have a problem here. I think you have an issue because we all have different cultural background. So something in one culture could be seen as a problem, whereas it might not be in another culture. So yeah, I think it's very important to find, at least for me, my own philosophy is, everyone's feelings and thoughts should be validated. If they are actually feeling this way, and I think that's very important for people to remember that.
I see. And I mean, going back to a little bit about your personal journey of becoming a clinical psychologist, at which point did you realize that you wanted to become one? And was what you thought like being or becoming a clinical psychologist was going to be like the same as
Mm.
your reality right now?
Yeah, I mean, so yeah, I don't have a specific reason or event that make me want to be a psychologist. But if one really quite a stupid thing came to my mind is like I remember when I was in primary school, I was like playing rock paper scissors with my friend, and I was like, "Oh, can I say something? And would that change the way they think and the way they behave?" And then I realized, and then I said, I think I just basically told him what I'm gonna play, and then I'm actually doing that, and then I won the game, and then I was just feel like, oh wow, human minds are so interesting. They thought
Wow.
I'm lying, but actually I didn't. I mean, it's it's quite it's nothing, but it's just kind of one event that kind of sparked my realization to realize that I'm actually really interested. But you could say a lot of people do interested, but I'm a really really curious person since a very young age. I asked like millions of questions that my mom would literally hate me for that. So and then as I grew up, I knew, oh, actually that's psychology. If we want to learn about people's mind and behaviors and stuff, and understand them. And then being an Asian kid, then the next thing you would need to think about how do you make a living.
Mm.
So clinical psychologists obviously come to my mind because if you want to study psychology, you need to go all the way to be a psychologist to be a professional. So yeah, that's actually how I got into it. Not very interesting or meaningful.
I think it was interesting. It was that tiny moment that
Yeah.
put you on the path, but it was all just sparked by how you were really curious about
Yeah.
how human minds work. But of course, I mentioned a little bit about like whether or not what you imagined
Yeah.
being a clinical psychologist was going to be like, whether or not it matches your reality. But I can
Mm.
also imagine there could be a lot of like misconceptions around
Mm.
like what clinical psychologists even do, which you mentioned briefly earlier in the conversation, where people might think that you can read minds.
Yeah. Yeah. If I could read minds or the other way, I'm just like chatting with people.
Right, right.
Yeah.
But I mean, from the reading mind point of view, like, would you kind of say more like finding the root causes of people's behaviors, like why people think a certain way, why people act or
Mm.
react to a certain things a certain way?
Mm. Yeah, I think That's really true. That's what we do. So we ask questions and try to understand, as you said, like why people have these thoughts, like why they're acting certain way, and why they're causing problems. But I think the reason why people think we can read minds, partly maybe because of the movie scene that's very misleading. TVB, I don't know.
There are a lot of like FBI micro
Yeah,
facial expressions.
exactly. And then I think there's this really famous TVB drama. I'm not sure if you watch it as a kid.
Oh,
Yes.
do you remember the title? Maybe our
I
listeners would
can't
know.
I can't remember, but it's like a detective drama where the character would be like, oh, this person's feet is pointing towards the door he wants to leave.
Is that true? I mean, not from the TV drama perspective, but is that true?
Well, I can't answer you this question because a lot of these things where people think you can read minds is because people are reading your body language to interpret what's going on in your head, right? But actually, maybe surprisingly, body language is not being taught in psychology. Since, if I'm right, I mean, I didn't attend all the lectures, but I don't think there is a module or a specific training to teach us, what this body language equals to. In my current training, maybe there's a slight touch, but actually, interestingly, we don't have much emphasis on how our body like
Positioned
yeah
or
we
moved,
don't learn that.
So there won't be a way for you to tell if a person is lying.
No.
Right.
No, I mean not in a not there's no specific technique.
The movies really got us tricked then, because they always like, in movies they're always like putting in a psychologist character, and then there will be a report it's like, this person is lying.
But they actually, I don't think they're psychologists. I think they're like just body language expert. Because what you're
there
talking
are
about,
a lot in the UK where they study the royal family.
Yeah, I know those YouTube videos,
and
right?
those are not psychologists.
No, please don't mix them up with us. No, yeah, so I mean, it's actually, I do personally think it's really important to at least have some basic knowledge about body language, because it gives you additional information in the therapy room about what's this person's going on, because a lot of time what they say might not be exactly reflecting what they're feeling. But yeah, we don't get trained body language, unfortunately.
Now, I would like to move on a little bit about, like some of the specific mental health issues that you have observed that would be kind of like taking place quite frequently in this day and age, or even like any potential issues that you would like to highlight within the Asian community. But just to get started, what are some of the most common mental issues that your clients are dealing with these days?
Yeah, so I think it's a really good question to highlight the cultural differences, especially between the Western and Asian. Because obviously I work in the UK, so with the NHS, so I work with predominantly white people and black people, brown people, so but English speaking people basically. And then I do some private work online with Hong Kong clients as well. So doing that simultaneously is quite interesting, because it made me realize how the importance of needing to tailor your approach depending on the person or where they come from. So when you talk about, what are the common issues in Asian community, I would say personally, because I might not have worked enough with Hong Kong clients yet, but personally so far what come across is issues with low self-esteem and low self-worth. So yeah, because a lot of the time, even though the surface level, the problems might look different. So maybe this person is low mood, depression. The other person is just more worrying, anxiety. But when we dig it down, you might realize it comes from quite similar beliefs in themselves, that they will think, oh, I am not good enough, I am a failure, I am incompetent, something like that. So these are really quite prominent in the Hong Kong clients that I work with. And then you could easily kind of link it to Asian parenting. Of course, they are not the only,
culprit.
No, lots of, I mean, and the societal level as well, obviously, and the overall culture. But you could see quite commonly people, because as a kid we internalize things that we hear. So for example, if I think I'm not good enough, I'm a piece of shit, I'm a failure, etc. Very likely these are the things that you were heard or you understood as a kid were internalized. And then as you grow up, these things become your own voice, but they actually were internalized maybe from your parents or from schools, teachers, anyone around you as a kid. So yeah, I think that's quite interesting, and also I think really important to highlight how parenting could shape a person, especially after they grow up. And the second thing is I realize in Hong Kong, I can't generalize obviously, but I do realize Hong Kong clients have relatively I don't want to say insights because I kind of got told off using that term, but like they're not as maybe reflective, or they don't have as much understandings about what emotions are, what feelings are. They're not as, you could like call, psychologically informed than people from the West. But then, I mean, not surprised, right? Because mental health, you would imagine Western culture is a lot more open to it anyway, and they would be naturally more far ahead than us. But I do remember working with Hong Kong clients, sometimes, and the terms they use as well. So for example, we speak in Cantonese, but I mention anxiety in Cantonese. The client will never identify his feeling as anxiety. He would just say, I'm just nervous. So I mean, then of course I will use the term they give me, but you can see, not a lot of people actually would use the term anxiety or even depression. So I have another client, I think we kind of work together, and then we identify or highlight, her low mood and everything. And then she was just like, oh, actually, knowing that I was feeling depressed already made me feel a lot better. So yeah, so I was actually surprised at how the difference between Hong Kong clients and the West in terms of their understanding of emotions, and the terms they use. And I think maybe my personal guess is sometimes anxiety and depression are terms that are quite stigmatized in the culture. So that could be the reason, I guess.
And would you also say maybe Hong Kong or Asian clients, they might lack the vocabularies or like the language to even properly describe how they feel?
Yeah, exactly. I think that's basically what I was trying to say.
Right,
Yeah.
Right. I see. That's interesting because I remember in one of our previous episodes, our guest is actually from Japan, and then she was telling me about how some of her Japanese friends were saying that they found it a lot easier to describe their feelings and emotions in English, despite they are not native English speakers, than their native Japanese language. So that kind of like made me realize, oh wow, maybe there's a tendency for like people from Asian cultures to be suffering a little bit more, or like to be a little bit lack the awareness about mental health, is because there just isn't a very comprehensive set of language for them to
and they're not quite being socialized to the idea of mental health. Like, what is it? What is psychology? What is therapy? I definitely agree with you.
I think maybe in the Asian context, if no one will tell people openly like, oh, I'm going through therapy. Like, no one says that, right?
Yeah, exactly.
And if they say that, their colleagues might think like, oh, So you have issues. So you're
Yeah.
crazy, right?
Yeah.
But I mean, I'm so curious, going back to the first problem that you mentioned, like people normally would suffer from a little bit of that low self-esteem. They think they're not enough. I mean, obviously, I know the approach can be very different on a case-by-case basis. But then what would be some of the like usual practices that you might suggest people to start looking into when they suffer from low
Mm.
self-esteem?
Oh wow, that's a good question. Another big question, I guess. Why should I think it depends on, so because low self-esteem stems from childhood, um, at least for most cases, because you won't, you could get more confident over time, um, but more or less part of it would stem from childhood, and depending on what your later experience is, you could get better or you could get worse, or you could suddenly get worse maybe after a really bad relationship. So it depends on how do you want to work on it. So what I mean is, do you want to work with the root cause of it, go all the way back to your childhood to understand where my low self-esteem comes from, or you be like, no, actually I would maybe want to see what kind of a day-to-day technique that I could do to just help me feel a bit better. So these would inform different type of approaches. So for the first one that I mentioned, I guess definitely you would need to look for a therapist to work together. For the latter one, it's more of like a CBT approach. So it's more of like, the techniques that you could use. So you could kind of what they call like reframing. So like reframe your negative thoughts about yourself. So let's say, I am not good enough. Okay, in what context you talking about? Let's say I'm not good enough at work. So people in CBT would tell you, okay, that's what you think and what you feel, but thoughts are not facts. So you might hear people say that a lot. Therapists would say thoughts are not facts. It doesn't necessarily define you. So it's just a thought there. So what are the facts that support your thought? So let's say you think I'm not good enough at work. So what are the facts that actually happened support this thought? You could say, well, I made a mistake, or I lost a client today, or a client ghosted me, etc. Or a boss told me off the other day. And then you will want to look at the other side as well. Okay, what shows you're actually good enough at work? So we want to focus on the facts there rather than your feeling or your thought, because they could be biased, right? There could be different reasons why you always have these thoughts in yourself. So you try to get like a balanced view. So that's how you try to like reframe this negative thought. Or on the other hand, you could like, do a positive diary, try to look at, 3 positive things about yourself every day. So these are like small techniques that you could try either maybe by yourself, with a friend, your partner, or with the therapist. But obviously it's easier said than done, because I know people would say, oh, I know I should, say I am good enough, but I don't feel it. Rationally, I know maybe I'm good, but I don't feel I'm good. So that might need a bit of a deeper work with a therapist or psychologist in a longer term therapy, because as I said, I think a lot of the times low self-esteem stems from way back than just suddenly you wake up and having a feeling that you're not good. Yeah.
But I mean, you did mention one of the solutions to dealing with, mental health issues like low self esteem. Like one of it would be to actually work with professional mental health practitioners like clinical psychologists or beyond. So that brings me to ask, how does one really know when they need to
Mm,
see a clinical psychologist or other types of mental health practitioners, for example, a psychiatrist, a
mm.
counselor? What's the difference between those three?
Yeah, so there are two different questions. The first one is, when basically you mean, when do you think you need to go therapy? Is
Right,
that what you mean?
right.
Or see psychiatrists? So I would say, let Okay, let's talk about therapy itself, because psychiatrists don't really do therapy. So let's say, oh, when do we go therapy? I would say personally, there are lots of different types of therapy, and I would say everyone would more or less benefit from therapy if you get an ethical therapist that won't do any harm, because I know that there are people out there actually who could cause harm. But let's say you get like a legit therapist or psychologist, I do think everyone would benefit from it, regardless of whether you think you have problems or not, because therapy help us, especially with the work that you do, that's longer term work that involves like learning about your past and everything, um rather than focusing on your current problems. It really help you to have like a build an awareness of yourself, like you look inwards about yourself, like understand yourself, like who are you, what happened to you, how these experiences shape certain patterns that you notice throughout your life, whether it's good or unhelpful patterns. And I think that's really important for personal growth. And also adding to the fact that, as a nation, we, or anyone who work hard, like we have a very fast paced life. We have very packed schedule, I guess you and I as well. There's barely a time that you would sit down and try to process your own feelings or think about yourself, or process what happened. So I think therapy could be a space for that. And if someone want to improve yourself, so I have clients, actually most of my Hong Kong clients, they don't really have like significant mental health problems or or issues, but sometimes just feel like, oh, I feel like I've been having these patterns or, unhelpful behaviors at work. Or they feel like, oh, I realize I'm always like, please people. I'm a people pleaser. They want to understand a bit more about why they react certain way or interact with other people in different relationship, why there's this patterns there. So I think as long as you feel like, oh, I want to improve myself, I want some personal growth, I would say therapy could help. And on the other hand, obviously, that's more like if you feel like you actually having mental health issues and distress, um, then you might ask, okay, when do I know that it's time for me to actually seek help from professionals? Given you might need to pay for it, or should I just try to manage it by myself first? I would say focus on the impact of it. So you look at your daily life, how's your daily functioning, how were you when you were normal, or when you were feeling okay? How does your life look like compared to now? Are you still going to work? Are you still seeing friends? How's your relationship with your family, your partner, etc.? And then see how significant this impact is and how long has it been. Then you can decide, okay, maybe it's been a while and it's actually been affecting my daily functioning quite a bit. Then maybe it's time to seek professional. But I wouldn't say there's this black and white answer, because you also need to take into account your financial affordability, because as far as I'm aware, it's a long waiting list again if you want to seek help from hospital authority. I'm not sure if that answer your question. So then your second part is, okay, how do I know who do I see? So maybe so far there are maybe 3 main titles that we can try to clarify. So that's psychologists, counselors, and psychiatrists, right? Also just came to my mind. So with the title of clinical psychologist, it's being protected in Hong Kong and also in the UK, as in that you actually need to be qualified to call yourself that. But if you call yourself psychologist, then it's not being protected. So you need to be careful. So some people could call themselves psychologists. You can call yourself psychologist because it's not being protected. Only clinical psychologists or other type of psychologists like educational psychologists, child psychologists, etc., are being protected. But if you just see like a generic psychologist title, then someone might need to be careful and check their qualifications. So let's talk about the difference between that and counselors and psychiatrists. So as I mentioned before, clinical psychologist has a specific qualification and degree that you need to take, right? But for counselors, to my knowledge, I think you don't need a psychology degree to call yourself a counselor. And again, I think it's not a protected title either. So I think people could just call themselves counselors. So most of the time, counselors would go through like a diploma course, like a postgraduate kind of diploma course that is maybe between 1 to 2 years.
In counseling, right?
Yeah, in
Right.
counseling. Then you can be a counselor. So if you think about it academically, you could argue that the qualification would be less than a clinical psychologist. But then don't mix up with counseling psychologist. So counseling psychologist is really similar to clinical psychologist. It's just maybe the course focus is slightly different. They call it a bit more humanistic, as in there's less focus on CBT but other models. In the UK, you also need a doctorate degree. So clinical and counseling psychologists, you could say they are quite similar, but counseling psychologists and counselors are totally different. So as I said, counselors, you need relatively less qualification. And then you get psychiatrists. So psychiatrist is a doctor, so they come from a medical background. They need to complete their medical degree, and then they specialize in psychiatry. I can't remember how long. I don't know, 2 years or 3
So
years.
they are technically medical doctors.
They are.
Right,
They are
right.
medical doctors, yes. So that's also the reason why psychiatrists can prescribe medications, whereas most clinical psychologists cannot. I said most because I think some states in United States can, but I think most cases clinical psychologists don't prescribe medications, but psychiatrists do. And also because of the background between us, the differences between us, because we come from a psychology background, whereas psychiatrist comes from a medical background, that makes our approach very, very different. Because for us, we use like a more holistic approach. We look at also we look at biologically, but for example, like whether your parents inherit the mental health problem as well, but we also look at other things that's equally important. So like your social factors, who's around you, and also psychologically as well. But then for psychiatrists, because they come from a medical background, naturally they will have a heavy focus on the biological aspects rather than other things. But then maybe some psychiatrists would do further training themselves to be a bit more holistic, but theoretically, psychiatrists are medical doctors. So when you go in and see a psychiatrist, you you will get a full hour session. I don't know about Hong Kong, maybe 10 minutes or half an hour max. But it's more of like a tick box exercise, because they make diagnosis just like the physical health, right? You got a cold, you got a flu, except you got cancer, all diagnosis. And they kind of use quite a similar approach to mental health problems. So they tick box. So they were like, oh, you got this criteria, tick, tick, tick. That's what you get. They give you a diagnosis. And the reason why they use diagnosis is also because that would inform their medications as well, because their guidelines. So if this person have this diagnosis, then you should take that medications. So that's how most psychiatrists work, I would say.
Would they also kind of come up with their diagnosis referencing any psychologists' reports or assessment? Like, do you guys sometimes work together, or it's a completely different work stream?
Yeah, so that's a really good question. But since I've always been in UK, I can't speak on behalf of Hong Kong. But in the UK, as I said, we work quite systemically in a team. So psychologists, psychiatrists do work together. But I would say there's always this kind of weird power dynamics between psychologists and psychiatrists, because as you can hear, we have quite a different approach. So, but then of course but in my team actually they work really effectively. They work well together. But then we do, maybe we will sometimes discuss the case together. But in terms of their professional choice of medications, they would not consult us because we don't train in medically anyway. So it would be their choice, or maybe. But in the UK, because there are guidelines about what you should do first, second, and third when someone come to you. So I think it is kind of suggested that maybe try therapy first, but then taking into account your preference, because some people be like, I don't believe in therapy, I'll just take medications. But medications or seeing psychiatrists usually is like a second step, rather than like a first level thing. But then in Hong Kong, I don't think there is any guidelines. So I do notice actually people do go to psychiatrists as the first instance, and when they realize they have problems. I might be wrong, but I do personally have clients where they told me, oh yeah, actually I've seen the psychiatrist, obviously not obviously, but they're not working, and then they came to me. But yeah, I just want to highlight we work quite a different approach, and I think the way we see mental health is quite different as well. They might see it as an illness, but for us we think it could be like a human reaction when you experience something very difficult or traumatic, right? Because if someone experience really traumatic or difficult things and they are all right, that kind of makes you like a robot. So we actually try to normalize a lot of these things, and at the same time, sometimes if the diagnosis helped, then we would still kind of reference that to help validate the person's problems, but try to label the person is never our intention if it's not helpful.
Wow. I learn a lot, and I really love how the psychology approach to like some of the mental issues is like they are more seen as the natural response to a certain causes or events rather than, like you mentioned, as an illness, which illness can sometimes have negative connotation. And before we move on to the next segment, I just have one quick question for you, Florence, because these days, I mean, from what you described earlier as well, like a lot of times it's down to the patient or the client himself or herself to realize the need of seeking professional help, right? And a lot of times these days, people might actually come across a certain social media post and be like, I guess it's time for me to see a psychologist because this social media post says so. So to what degree do you think social media is helping people prioritize or like treat their mental health issues, or like do you think that maybe sometimes the unprofessional disinformation or misinformation could also cause some issues?
Yeah, I think you highlighted a really key issue, I would say, about social media, because I do personally come across quite a lot of psychology posts, or even people who claim to be psychologists who actually got interviewed and actually spreading information that I feel like that's not quite right. Because sometimes social media is also about getting engagement, right? So they will need to use these like really hooks, like psychologists said. But I was like, no, we don't say that. So I would say that's also kind of linked to what I said earlier about the issue could present with diagnosis. Because if you see, when you said, oh, there's a checklist, you basically try to diagnose this yourself. So that's also the reason why I think diagnosis could be helpful in one way, but we need to be careful with how much weight we put on that. Because it might be helpful to inform us, okay, which directions we are heading to, like what kind of problems that we might be having. But if we see a post and then we tick all the boxes and then we give ourselves a label, I think there is actually a study to say that when someone got a diagnosis, they actually would have worse symptoms, because your brain may feel like, oh,
Amplifying.
exactly, you feel like, oh, I'm given this diagnosis. then you could be more biased in actually acting in a way that is in line with the diagnosis. So I think there are examples that I heard, and definitely studies to show that, for example, depression or psychosis, somebody got diagnosis for psychosis. So psychosis is basically you have hallucinations or of seeing things, hearing things that people don't see or hear, or you have delusional thoughts, thinking I'm on top of the world, I'm God, something like that. So this is psychosis. So when they're given this diagnosis, their symptoms got a lot worse. So I think we have to be really, really careful about, what are you gonna get out of if you give yourself this label, rather than, try to understand what actually happened to you. Because personally, I think with mental health problems or emotional problems, self acceptance is really important, because the more you try to push yourself away from your problems or your feelings, the more they will actually come back to you, or even even more be more overwhelming. So self acceptance and validate your feelings, I feel like is really important. But then if you really fixated on the diagnosis, it's quite disempowering as well, because you feel like, oh, yeah, I have depression, and again, it's stigmatized. I shouldn't be depressed, I cannot be depressed, and I'm ill. So I feel like there's, as you said, there's a lot of negative connotations with diagnosis, because it kind of even almost put you in a passive role to feel like, oh, I'm here, fix me. Some people will become to therapy expecting therapists or psychologists to fix them, and I think that's understandable, because maybe they feel really helpless. But I feel like it's also very important to empower people to understand that actually you're not ill, you're not broken. We help them to understand, oh, actually we maybe like try to like lay out a timeline for them to, and then they realize that, oh, well, I've gone through quite a lot, so it's actually understandable that why am I depressed, especially maybe when I did not have a good support network. I didn't know how to deal with it. Of course, I'm depressed. So, us as psychologists, we try to use this way that we think is maybe more helpful than just kind of throw your diagnosis, be like, oh, yes, you have major depressive disorder, antidepressants, and here you go. But maybe that person is actually in a very toxic relationship. Maybe they're in a really unhappy job, maybe there are other things going on for them. So I think diagnosis could be helpful, especially for people to communicate with other people what's going on with them or get the medications. But I think everyone should be careful with how fixated you are. And I feel like I'm kind of deviating from your social media question. But yeah, I think with the social media, we can use them as reference. But if you want to really know what's going on, I would really suggest to ask advice from professionals. And also, if people are interested in mental health or psychology and want to follow social media posts, I think that's great. I personally do that as well, 'cause especially I don't really like reading, but scrolling Instagram is so easy, and I learn a lot of things. And there are actually a lot of really high quality posts. But then I feel like it's hard for lay people to differentiate, what's good and what's not, or reliable. Maybe I personally would try to see if they put like who's the person behind this account, and maybe check their qualification. I feel like that's maybe one way to do it.
I mean, those are really practical tips for people and mindset for people to adopt whenever they are seeing this kind of psychology content on social media. And also, it's very important to note that, having mental health issues or having depression should not be seen as a trend or as a personality, which social media tends to work a lot better with trends, right? Like, for example, I've read an article in the US. For example, if you're on TikTok, if you look at one depression-related TikTok video on the app, and the algorithm would start feeding you a lot of depression-related videos, and that might prompt the person to have that tendency of thinking that he or she also is in the same mindset as the creators of all these depression-related videos. But that's just how the algorithm works, right? If you like are looking at a certain trend, post topics, and that's all they're going to feed you. Yeah.
Yeah. Because I don't use TikTok, but that makes a lot of sense. Because I think, and then the videos are like one after the other.
Exactly. And that becomes some sort of like a virtual echo chamber, because you just feel like that's your whole world.
Yeah.
Because that's all you see.
Yeah. And again, because they would be biased and thinking, oh, I have depression. And as I said, it's very likely that they might actually act in a way that's in line with depression. And that reminds me of something else about TikTok as well. I think back then people said people with tic disorder. So basically, I think it's a neurological disorder where people would like have some involuntary like gestures or like words they say, and then somehow like some videos gone viral on TikTok, and then like some teenagers became, I don't know if they try to pretend they have it, or and then some people literally develop tic disorder from watching videos about it. So yeah, I think it is actually quite problematic with social media.
Yeah. I guess we all just need to be very aware. Like, it could be a very good tool, like you mentioned. It kind of opens up the access to some of the useful and legit psychology knowledge in a fun and interesting format. But now I think it only makes sense for us to move on to the next segment, which is our listeners' favorite segment, Rapid Fires. Now, in this segment, I'll be asking my guests biased questions that they've got asked at some point in life. And in Florence's case, it will be some of the misconceptions and biases that people have about what she does, or like even mental health issues in general. So, Florence, are you ready?
Not quite, but we can start.
You're the best person to answer these questions.
In this room, maybe.
In this room, yes. Now, first question. You are a clinical psychologist. Can you read my mind?
I think we talked about that, right? I'm sorry, but we can't. Surprisingly.
No.
Well, I mean, we talk about it, how it's about body language, and we don't really get professionally trained in that. But we I think, apart from the fact that maybe people get that from movies, I was thinking maybe the other reason is we ask questions and try to understand your thoughts, feelings, everything, and then we actually would make hypotheses about, okay, how's that linked to your problems that you mentioned? And the more you work, we are all human beings to an extent that actually there will be some patterns. If someone have certain, behavior, certain thoughts and stuff, we could hypothesize similar problems or similar link for these people. So maybe that's the reason why, that could be the reason why people think we can read minds, because maybe some people mention something and then we make a hypothesis. Oh, do you think, is it because of that? What do you think? Especially when chatting as a friend, we would be easily to make assumptions because we're not like working, because we would just be straightforward and be like, oh, do you think it's that? And because that actually comes from our experience, so maybe that's why people feel like they could read minds. Because sometimes I remember like my friends asked me something and I was like, oh, is it because this and that? And she's like, oh my god, how do you read my mind? And then the next second he was like, oh my god, how do you read her mind? Like the person that he was talking about. So yeah, I guess that could be the reason why.
Well, I guess that could work in your favor, right? Because some of your friends, if they don't know, if they really think that you read their minds, they would think that they should not lie to you.
Well, funny enough, I get lied to a lot.
And you couldn't tell.
I'm very gullible.
Oh dear. Now the next question. Therapy doesn't work.
Actually, I'm lucky that I don't personally hear this so far. Or maybe I did, I just kind of filter it out. Fair play doesn't work. I would say I don't disagree, because nothing works for everybody. There's no one size fits all. And so as medications doesn't work for everybody anyway. So yeah, I would say it doesn't work for everybody, but how do you know if you don't try it? And I think there are lots of different reasons why therapy doesn't work for somebody, because therapy is also a lot about the therapeutic relationship you have with the therapist or psychologist, and we don't get along with everyone. So sometimes it's like dating, right? On Tinder, you don't know who's gonna match you. You see the profile, looks great, and you have a coffee and you realize you're not compatible. So I think that's similar to therapy. You need to find a therapist that actually compatible with you. So that's one thing. And I think the second thing is also depending on where you're at in your life and your readiness for therapy. So as I mentioned, there are different types of therapy. So there's this well-known CBT, which is about, making changes to your current life, what you can do. You learn techniques and you change the way you deal with things or you think about things. But not everyone is ready to make changes yet, right? It's easier said than done. I know all the theory, but I can't do it. But it doesn't mean that therapy is not suitable for you. It's just this specific type of therapy, which is CBT, might not be suitable. But there are loads of other forms of therapy that could be helpful. For example, some therapy that, for example, we call psychodynamic therapy, that focus on, dealing with your past, your subconscious mind. There are lots of different types of therapy, and I feel like it's all about finding the right fit for you. And unfortunately, it takes time. It takes money as well, efforts as well. But maybe ultimately you would say, well, nothing works. Then yeah, maybe nothing works. Maybe this person needs more medications to stabilize their problems first. So yeah, I would partially agree with this, I would say.
And the next question is, you are just chatting with people.
Yeah, I think I put that because I really get offended by this. Please don't say that. Yeah, I think, but I don't blame people, because they're not obligated to know about our profession just like us to other profession. But I say this is a misconception again, maybe on TV. People see the patient lie on the couch and the psychologist sitting here, but that's not what happened. We don't have anyone who lie on the couch. We sit on a chair. Anyway, so I would say chatting or talking to people is a medium for us to do therapy, because talking is the clearest way to know what that person is trying to say, rather than sign language or body language. It's just a medium. But there's a lot more behind that, because we are not just chatting with you like, how's your day? So that's more like counseling, actually. Counseling is more like, you come in, tell me about your day or your problem, and then I more put myself in a more like a listener place. But for proper therapy, it's not just about chatting. We ask you some maybe hard questions to really get you thinking what's going on. And chatting was just a medium. So it's just like medications, right? You take a medication, it's really easy, you swallow it. But it's not about how you swallow the medication, it's about what's inside the medications that helps you. So yeah, I would say
Okay, got it. And last question in this segment. Having mental health issues means you are crazy.
I think maybe in Asia or Hong Kong, it's still, mental health is still something that especially the older generation that's not quite open to yet, right? So I would say, how do I address this? I would say, first of all, as I said earlier, mental health problems or issues or these diagnoses I would see it as a human reaction when things become really challenging and hard for you. And when you say craziness, I'm not sure if they're more of referring to people with psychosis, because I know there are like some news recently about people with psychosis and tried to stab someone. Do you remember that?
I do remember actually last year there were some cases of like violence that might be to do with mental health patients, but there were a lot of talks around the person being mentally ill rather than, the action of the person.
Yeah. I think definitely media has a lot about that. But I think, rather than thinking that person is crazy, actually people with mental health issues, especially for psychosis, to hurt other people is a lot less likely than them being hurt. There's research to support that. I can't say for other mental health problems, especially for psychosis, but I would imagine similar to other mental health issues. I would say it's more of how the media portray these people. And I think, to be honest, I think being able to accept or even tell people that you have mental health problems and to seek help is the least crazy thing, isn't it? Because you are accepting yourself and you're trying to seek help and to be better. So I think I don't know how to debunk that, but just to have a more empathy for people and help, and it's all bias, isn't it? So how about all these other criminals that don't have mental issues they report? It's just the news wouldn't mention them. So I think it's important to understand before we judge, I would say. I think in Hong Kong, I personally feel like people could be quite judgmental. We see something, we judge them straight away. But I feel like as someone who's outside of the picture, who have very limited information, it's really not fair to make that judgment. News are news, and I would say with everything as well, when we hear people having mental health issues or diagnosis or problems, why don't we try to have more information and find out a bit more before labeling them crazy? Because imagine if you know what had happened to them and imagine what that happened on you, would you think you are crazy to have the same reaction as them? But I feel like it's a long journey to destigmatize these things.
We really need to become a lot aware about like our assumptions or like ill-informed thoughts, and just don't make any assumptions before you even know any facts, which is the key point of this whole rapid bias segment. But thank you so much for answering all the questions, Florence. And now for us to close out the episode, as the joyful occasion of Lunar New Year is approaching for a lot of like Asian communities around the world. I mean, it's great. Like for us, for all the Asians who celebrate Lunar New Year, they get 2 chances to start a new year, which is the Western New Year. If you flop that, it's fine. Lunar New Year is just approaching on the horizon, and it's another new year, new you. So as Lunar New Year is approaching, I'm curious, like it's also famous to be the occasion where we are subjected to like toxic comments from our cousins, aunties, and uncles. I'm wondering if you have any takes on like how our listeners or like Asian communities can kind of stay sane, protect their mental health while making their rounds, meeting uncles and aunties that they only get to meet once a year.
I think personally, it's a harder question for me because I think I'm lucky enough to not have gone through that. I just happen to have nice and understanding family members who wouldn't ask me all those questions. But I was thinking, actually, let me ask you, like, what about these questions that trigger you?
I guess like some of the common questions that a lot of our like listeners or like even on social media, the Asian communities would point out would be around how like uncles and aunties could like make very straightforward comments about your body. For example, like, oh, you got fat.
Oh, yes, I
It's
got that too.
hurtful to some people,
Yeah.
right? It doesn't really hurt me as much. It was just like, oh, great. It means I ate well. Thank
Yeah.
you. You know, but sometimes it could be very hurtful for other people. Or for example, like, oh, sometimes some of the very direct comments are, oh, why aren't you married? Like, does no one want to be with you? Something
Yeah.
like that,
Because I
right?
asked that question because I was thinking, if, for example, you said people ask, oh, said you got fat, but you don't really mind. You just say, oh, I ate well.
Mhm.
I wonder why then certain questions would hurt someone but not the other. So I was thinking,
Mm.
what's actually the reason behind that question that trigger you? Because
Right.
if you're confident, if you feel like it's not a problem, then it would just slip my mind. It wouldn't really trigger me. So I'm just curious, like, what about this question that actually trigger you, and why does it trigger you and not the other person?
Mm.
And if you say, okay, it trigger you, then it must mean that some element about this question actually reminds something about you, maybe. That's why
Right.
I'm just making assumption here.
Which is what you mentioned earlier about like low self-esteem. Like a lot of it is like
Mm,
internalized since
mm,
childhood. You know, I could also speak to some of the common Asian toxic traits. For example, like parents or uncles and aunties would like to compare the children, right? It's like,
yeah.
oh, look at your cousin A. You know, he got straight A's, went
Yeah.
to this university, is working as a doctor. What about you,
Yeah.
right?
Yeah, exactly. But then if that person also feel confident about themselves, they won't
Mm,
care. I don't care what comments you make on me. I'm happy with what I'm doing. I'm happy with what I've achieved. So I think the key is to actually, think deeper than that and think, oh, why does that certain question really trigger me? Does it mean that I also maybe think in that way to an extent? That's why it's
mm,
more hurtful because for example, I'm very insecure about my body, and if someone make comment on it, of course I will be hurt. But then I'm very proud of my profession. So if
mm.
someone make comments about my profession, it's like I don't care what you say.
Yeah, it's
So I think
true.
it's actually a message to tell yourself, and then we can think about, okay, if that's actually something that trigger me, do you want to work on it? But then I feel like this is the more like a clinical way to deal
Yeah.
with it. But I think the short way to deal with it, I personally was thinking maybe ask them a question back. I feel like the best way
Why
to
did
do.
you get fat,
No, no.
auntie?
I was like, okay, but what makes you say that? Just
Right.
throw that. Like, oh, really? What makes you say that? Or
And
why
that's when
did
you'll be
yeah, yeah. Or
like,
like, oh, why do you get married? Why are you not married yet? Okay. Oh, so you think I should be married now? Why do you think so? And then
mm.
they'd be like, oh, I'm not sure. So
Oh.
yeah, I feel like it's always easy to, just throw a question back to them and see what they say.
I know. It's like, oh, why are you not married? It's like, oh, why should I be? It's
Yeah,
like, why not?
exactly. Yeah, and they just carry on.
Yeah. And I mean, I do think on one hand, like you mentioned, from the clinical point of view, on an individual level, there are ways we can work on becoming a little bit more like confident. There are techniques that we can apply where we can be a little bit more resilient in the face of these
Yeah.
like hurtful comments. But I do think like collectively as like, Asian communities, there is also that like emphasis that we need to start maybe going beyond like
Yeah.
some of the toxic traits that we are so used to. Like when you show that you're hurt by these comments, like the aunties and uncles or grandmas, they were just like, we have always made fun of young people that way. We've always done it that way. But
Yeah.
sometimes the exact thinking of like we have always done it that way could be quite toxic. And
Yes.
and we need to collectively understand that like we can go beyond that. We can improve beyond what we have always done.
Yeah. Yeah, I agree. And I think it's quite hard though to try to change the family's narrative, especially if they're grandma's level,
I know.
they're grandmas. You can't argue with grandmas. But I feel like it's more about the message you get out of it. Because for example, if someone said, a grandma said, oh, you gain weight. And if I interpret it as, oh, she thinks I'm fat, I'm ugly,
Mm.
then it's negative. Of course, I feel hurt. But then if I reframe it and think, well, grandma loves me every time she feeds me food. So maybe that's a way for her to show that, oh, she cares about me, oh, you
Mm.
gain weight, but it's just a comment, but she actually loves me. Maybe that way would make me feel slightly better.
That's true. That's true. I guess another way for like I personally would cope is just like I only see these people, like once a year or like
Yeah.
once every 5 years. So whatever they say, it doesn't really apply to my life because they
Yeah.
know nothing about me. So just
Yeah.
like, why should I even, give energy and time to worry about what they're going to say about me, right?
Yeah.
So there are so many ways, but I mean, Lunar New Year could be a whole different episode.
Yeah. Well, you get pocket money, so
Yes, that's true.
maybe it's worth it.
You can tell me I got fat all you want, but just give me
Just
my
give me money.
lycee.
Yeah. Yeah.
And finally, for us to leave the episode, we always ask our guests this question, which is Florence, to you specifically. What does it mean to be proudly Asian?
I think that's a really good question you put, because I never associate these two words together.
Mm.
I'm not sure if it's being said by other guests, but proud and Asian. Oh, I'm a proud Asian. It's actually the first time come to my head this way. What does it mean? I would say I am. It's very ironic. I can't think of anything that I'm proud of being Asian, but I mean, there is. It's just not natural to me. I feel like as an Asian, we have traits that I really love the Asian culture, even though, especially me being in the UK for quite a while, I experience, both cultures, and I can make comparisons. And I really like the collectivist aspects of Asian community. We always come together with friends, with families. We love sharing, and I think sharing is a really key thing that I really enjoy, and I like doing it. And when I was in the UK, I was like, what? You don't share food? So I think sharing food is something I'm proud of.
You
Not
get to
is
eat
it
more that way.
Yeah, and then I hope they don't watch this episode, but when I hang out with my course mates, it's very individualistic, right?
Mm.
And we all have different food, and we bring to lunch, and I sometimes I see, oh, she got big bowl of pasta. I don't think she can finish it. I was like, oh, can I have some? She's like, I'm not finished yet. And I was like, okay. And then when somebody got some fruits, right? Some grapes. And I was hoping, would they offer me some? But no.
What?
So everyone is very, very individual. I'm not saying
Mm.
it's a bad culture, just saying, but it's just they don't share. Or even I try to share, they don't take it. So, when I
Mm.
got some snacks, I really want to share with everybody. It's good. I want everyone to enjoy it. But no one will care. No one will, it's like anyone. It's like, no. They don't want. Yeah,
Interesting.
so I feel like the sharing culture, the collectivist sides of Asian community, I really appreciate it. I really like it. And also I feel like it's good for mental health in a way that, we easily have a good support system, assuming that is a non-toxic support system, right?
Mm.
But in Western culture, it's very individualistic. So, when people grow up, you turn 18, you move out. And I was like, I've seen problems where older people are really lonely because
Mm.
their kids are grown up and they have their family, they move away. Whereas maybe some kids or, some young people are struggling because they are young, they haven't made enough money yet, they're struggling. So why don't they just come together to help each other? So that's actually been a question in my mind, the individualistic culture. But yeah, food is one thing come to my mind as a
For
proudly Asian.
sure, for sure. You
Yeah.
can never have like a Chinese meal by yourself.
Exactly. A hot pot is quite sad.
I know
Yeah.
it's sad.
Yeah.
I would sometimes do that just because I love hot pot.
Oh,
But
okay.
well,
Yeah,
I
you
mean,
get like small hot pots. Yeah.
mini hot pot.
Yeah,
But
yeah.
thank you so much for your response just now. I mean, I just wanted to clarify that it's like throughout the course of interviewing the different interviewees, like how they approach the proudly Asian question is so interesting because like just because you're asked that, it doesn't mean you have reached that destination of being a proud
Oh.
Asian already. Like so many of our guests have like mentioned to us that they went from like not knowing what that means to eventually embarking on a journey to like learning to appreciate everything there is about being Asian or half Asian. So I think it's so interesting that, you know, how you mentioned earlier that, oh, this was something that never occurred to you, but then later on you also were able to put it in a way that's like, oh, like people from, you know, their eating habits or behaviors, and how like this is actually what's great about being Asian.
Yeah.
But thank you so much for joining us on this episode, Florence.
No, I really enjoyed the conversation. Yeah.
You need to come back.
Yeah, for sure.
That's it for this episode of Proudly Asian. Don't forget to follow us on Instagram at proudly.asian for more content. We are on Spotify, Apple Podcasts, and YouTube. Leave us a 5-star review on wherever you get your podcasts. Thanks for tuning in and signing off for now. I'm Isabel Wong.